With the rapid spread of COVID-19 across the world, the ability of countries to address and respond to non-communicable diseases was impacted. The virus caused broad disruptions to several essential services, while at the same time drawing attention to countries' non-communicable disease burden as people living with non-communicable diseases become susceptible to the virus. In mid-March of 2020, when Uganda went into a total lockdown, the delivery of many essential health services was heavily disrupted. The non-communicable disease clinics at national and regional hospitals were partly closed as a control measure against the rapid spread of COVID-19 among the NCD patients. This action, among others, disrupted the routine medical care and hindered access to other healthcare services. Ministry of Health figures put the number of people infected with the coronavirus at 39,883 and 327 deaths by week 1 of February 2021.
When the lockdown happened, there was interruption of health services, especially NCD services.
There's a time when we had, I think, 20 patients in our outpatient clinic. And in our outpatient clinic, we usually have 140 to 180 patients in one day. So if you have 20 out of 180, you can imagine the rest 160 are not able to come. Because one, every person to travel was required to have a letter from the RDC. And then there was no transport.
Whatever the case, most people living with non-communicable diseases were greatly affected and inconvenienced. Unfortunately, their desperate plight mostly went unnoticed during the lockdown that was imposed by government. Increased operational costs were also incurred by health facilities so as to meet the standard operating procedures that were crucial in order to keep both the patients and health workers safe from getting the coronavirus.
The operational costs were high because this is something we are not ready for. You find that the cost of operation was high. You find that in the past we used to buy a box of a glove at 10,000. Right now a box of a glove goes between 40 to 50,000. We hadn't budgeted for sanitizers.
Rachel Kisache was one of those to suffer during the lockdown. In her early 50s, she is living with diabetes and its complications. She resides in Kabale village in Entebbe municipality, is unemployed, an amputee, and a mother of 2 adolescent children. Living with this condition means she is more susceptible to the coronavirus and has to take extra care not to mingle freely.
In the beginning, when it had just started in March, life was not easy. Because, one, we were totally inside our houses.
Yet, she needed and still needs to exercise in order to better manage her diabetes. Sadly, the abrupt and stringent restrictions that were imposed equally grounded public and private transportation. Without readily available transport, she could not get to hospital for her routine clinics, checkups and treatment.
Transport was a problem. Borders were not moving. No vehicle I could not foot.
They had complications because their drugs or their medications were over. They could not get more. So, with diabetes, it is they take medication for the control of their sugar. So once they stop taking, then the sugar always raises high.
As a result of not regularly attending her weekly clinics, Kisache developed cardiovascular complications. Rachel Sentamu, her benefactor and friend, talks about the incident.
One time she got a severe severe illness within this COVID season, and she called us and we came up as a church.
But luckily for Kisache and other patients, Entebbe Hospital, where she gets treatment, eventually arranged outreaches in order to keep them on track with their treatment. The decision followed reports of deaths and increasing complications as the result of of not taking medicines in time or at all. The outreaches were arranged with the help of the 800-member Entebbe Diabetes Association. Had this not happened, it could have been even more devastating.
COVID-19 did affect us so much, because we even lost members. More than 9 members died during COVID-19 because of lack of medicine. Because during that lockdown, our clinic was not operating. So when we started losing members because of lack of whatever, then we sat down, me and the chairperson, Nanyange Sarah, we approached Dr. Mwanga, director, and we sort of making a mobile, and we started doing outreaches.
Despite this, not all patients could attend the outreaches due to communication challenges at the time. Neither was it easy for the medical people to reach them.
It was hard by then for the transporting. Our patients could not turn up because of poor information they could get. We could not be able to inform them all that we are in this place, so you attend. And then us could be still very hard to move to those places, transporting the drugs. Since we didn't have the facilitation of the vehicles, you could find the ambulances are for COVID by then, so it was really hard.
How did COVID-19 pandemic affect us as health workers? One, those restrictions were also affecting us. There was no public transport, and many of us, do not drive our own cars. Many of us use public transport, so it was really a nightmare for some of our staff to come to work.
All in all, the COVID-19 period was so challenging to people living with NCDs. The total lockdown and its severe complications, such as very limited access to medical care and other health benefits, put the life of a person living with NCDs at crossroads day by day. There was literally no work. Yet earnings are essential in order to buy the necessities such as foods and fruits, vegetables, recommended for managing NCDs like diabetes and other NCDs. Now that the lockdown was eased, Kisache, like many others, can attend clinics without having to fear. But it could have been worse, especially if her cardiovascular complications had found her at the height of the lockdown when no easy movement was allowed at all.